Good morning, Peter Goertz. I'm a psychiatrist, supervising medical students and residents. Yesterday, I was in the hospital working with a resident, and that made me think of this topic. One basic thing is humility on the part of the psychiatrist. As a psychiatrist, you want to embrace the fact that there's a lot you don't know, so you never want to be condescending toward the residents or medical students and never want to make them feel like they don't know anything. And one basic thing from a different perspective to transmit to residents is that medicine and psychiatry, at least in my opinion, are magical fields in the sense that there's a lot that's not known, there's enormous room for creativity, but of course, if you want to transmit that feeling, it has to be genuine. So if you don't feel that way, you can't really transmit that, in my opinion. And it's important also to help the residents and medical students realize that enjoying themselves is crucial. The top priority, in my opinion, is safety of the patients, safety of the staff, safety of the students, safety of the residents. However, right after that is enjoying ourselves, because we're going to be in our careers for decades, and there's really no point in doing this if we're not enjoying our work. And I've learned a lot from, at least as much as I've taught, I would say, from medical students and residents over the years. And I'm very grateful to the medical students and residents whom I've worked with over the years so far. And sometimes when I'm talking with them, all of a sudden I realize I don't even know what I'm talking about. So it's great to have that check there from the residents and reality check, so you realize how little you know. And another thing to realize is psychiatric rotations for medical students and working on psychiatric wards, for example, for residents can be traumatic. I remember a medical student who saw one of her patients assault a psychiatrist. I think she witnessed that, or at least she was there on the rotation when that happened. And then another one of her patients had to be transferred to a medical ward because of a medical problem, and then overdosed within a day or so on heroin and died on the medical floor. So that type of thing can be traumatic for medical students and residents to deal with. And you want to be kind as a psychiatrist. Of course, it could be traumatic for you to deal with these things as a psychiatrist also. And how much responsibility do you want to give medical students and residents when you're teaching them, or while they're rotating with you, while they're working with you? It's a balance, in my opinion. I remember watching an attending psychiatrist talk with a medical student about the medical student's note and literally go through every word of the note with a medical student. To me, that sounded like pulling teeth, basically. That would have been really difficult for me to do, and probably not that pleasant for the resident or for the medical student to go through, to have that much supervision of every word of their note. But everyone has a different style. So anyway, that's not my style. And on the other hand, you don't want to give the residents and medical students too much freedom, because they might recommend two medications that interact adversely with each other and potentially could cause problems for the patient. So it's a fine line, and as a psychiatrist, in my opinion, you want to go with your gut and do what feels right to you. If something doesn't feel right, if you feel the resident needs more supervision, do that. And of course, there can be bad outcomes. I remember one of a resident's patients died. I was supervising that resident in a clinic, and one of the family members of the patient who died was very upset. And I remember talking on the phone with that family member, with the resident present. But in that case, actually, in my opinion, there was nothing that the resident did in that situation that was connected with the patient's death, or there was nothing, quote, wrong, in my opinion, medically, that the resident did. But basically, you want to balance independence of the residents and medical students. You want to give them as much independence as possible for whatever stage they're in. And you want to also, of course, balance that with the safety of the patient. So as much independence as possible, you want to give them as much supervision as necessary. And teaching, that doesn't necessarily, formal teaching and lectures is great, but there's a lot of teaching that can go on aside from formal lectures. For example, I remember working on a medical psychiatric ward, so a combination, and you can teach the residents and medical students simple things, not even necessarily psychiatric. I remember teaching one medical student how to draw blood from the groin for a patient who had very poor veins, maybe from IV drug use. And so little things like that, you can teach them. And of course, they teach you a lot. So that's my perspective. Thank you.